Let's talk about a concept that is transforming perioperative care, prehabilitation, and how anesthesiologists are increasingly central to its implementation. Traditionally, preoperative assessments have focused on identifying surgical risk factors, but they haven't always translated into active interventions to reduce those risks. Prehabilitation changes that dynamic. It is a proactive, multidisciplinary approach that aims to enhance a patient's physical, nutritional, and psychological status before surgery in order to improve outcomes after surgery. The evidence is growing that this approach reduces post-operative complications, shortens hospital stays, and facilitates a faster return to baseline function, particularly in frail or elderly patients and those undergoing major procedures like cancer surgery. As the field of anesthesiology has evolved, so has our role, from being focused primarily on intraoperative care and post-operative pain control to embracing the broader scope of perioperative medicine. A comprehensive prehabilitation program typically consists of 4 core components: physical training, nutritional support, psychological preparation, and lifestyle modification. Exercise programs, tailored to each patient, can improve aerobic capacity and muscle strength. Nutritional interventions, such as protein supplementation or treating anemia, support metabolic resilience and tissue healing. Psychological support, including stress management and preoperative education, can reduce anxiety and improve patient engagement. Finally, lifestyle changes like smoking and alcohol cessation are critical to reducing perioperative risk and promoting recovery. Not all patients require the same level of intervention, so risk stratification is an important part of the process. Tools like the Duke Activity Status Index, grip strength, or frailty assessments can help identify those most likely to benefit. For higher-risk patients or those undergoing complex surgery, cardiopulmonary exercise testing, CPET, can provide valuable insights into functional reserve and guide the intensity of prehab. In 2021, Dr. Kali and colleagues proposed a transformative model that integrates prehabilitation into routine preoperative clinics. This model calls for a structured, multidisciplinary approach involving anesthesiologists, surgeons, physiotherapists, dietitians, and psychologists. Early referral, ideally at the time surgery is being considered, is essential to allow enough time for meaningful intervention. The care plan is personalized, delivered either in person or via telehealth platforms, which helps overcome barriers such as travel and access to care. This integrated clinic model shifts the focus from risk identification to risk reduction, which aligns with the principles of value-based and patient-centered care. Implementing this model does come with challenges. These include the need for additional resources, the importance of early referrals, and the necessity of educating both patients and clinicians on the benefits of prehabilitation. However, these challenges are surmountable. With proper coordination and institutional support, prehabilitation can be embedded into surgical pathways, especially for high-risk patients. Early studies and pilot programs have demonstrated promising results. Prehabilitation has been shown to improve physical performance pre-operatively, reduce complications post-operatively, and lead to faster functional recovery. It also contributes to higher patient satisfaction and potentially improved long-term outcomes. Though more large-scale randomized trials are underway, the available evidence strongly supports the value of prehabilitation in surgical care. In conclusion, prehabilitation is not a luxury. It is becoming a necessity. It represents a shift from reactive to proactive care, from fragmented interventions to integrated, team-based preparation. And anesthesiologists are uniquely positioned to lead this change. By identifying risk early, coordinating multidisciplinary interventions, and tailoring perioperative care plans, we can ensure that our patients are not only fit for surgery, but fit for life after surgery.